What are your thoughts? And I had heard you do, you'd given a Lifetime Achievement Award speech at IHS a few years back, and I even taped it. I think it was like 45 minutes long, and you talked about your history, and it was just extraordinary. But you also weighed in on Western medicine. You weighed in on sort of the pros and cons of, sort of what was going on in Western medicine, and you were really thoughtful and very opinionated, I thought, in what I agreed with, but certainly you were not afraid to hold back. And, given all of the work you've done on both sides, on in Western medicine and integrative medicine and everything in between, what are your thoughts on where we are with healing now in conventional Western medicine? And where do you think this is going? Are there good things and bad? I mean, technology is interesting and that's changing rapidly, but are we still not getting to sort of the root causes of a lot of our problems? What are your thoughts?
I think we need to have a bigger view, make the world bigger, not smaller.
Yeah.
I
Yeah.
think we
Yeah.
need to have a bigger view. So I've known lots and lots of clinicians, physicians, doctors, nurse practitioners, PAs, nurses, just, techs. Um, People go into this not because they're thinking they're going to make a lot of money or they're going to have a lot of fame. They go in because they generally want to help people. So I think that there's a lot of good we do. You and I both seen people come into an emergency room that we thought may die, and then 2 weeks later be discharged from the hospital. Like you're like, oh my gosh, I've seen trauma, sepsis, amazing things. We do amazing things with sort of acute care, right? Where I think we
Hmm.
struggle and we continue to struggle is that our model of care is 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 very rushed. We often don't have enough time to do what we need to do. We reward, we really reward procedures over conversation. So, an orthopedic surgeon who did my hip replacement, it was $64,000. And I remember Jim saying, I wonder how much we'd have to have in clinic for you to bill $64,000 as a primary care provider. So, it's also set up in a way that doesn't really reward conversation and that primary care kind of, angle. I think that, we need a different approach in medical school. We need a different approach in residency. We need to think about how do we help healers um, be healers? How do we continue to help them understand about the importance of lifestyle? If we're working 80 hours a week and we're not taking care of ourselves, why would we think that was important for a patient? If we're not sleeping well and we're really stressed and we're on call all the time, and we don't eat well, why would we think that was something important to share with a patient? And so, I've often found that it's difficult to extend compassion to others when there is not compassion to self. So if I'm not really compassionate to self, it's difficult for me then to be compassionate to others. And there's a lot of things in medicine that shut down compassion, not intentionally, but it just happens over time.
Hmm.
So I would say that Western medicine has brought a lot of good, and, nobody can argue with that. I wouldn't. You can always tell what you value if you can imagine the next day it could being completely gone. Imagine tomorrow there's no hospitals, there's no paramedics, there's no doctors, no nurses, no techs, no medication, no medicine, no pharmaceuticals, no nothing. What would the world be like? I would say it would not be a good world. It would not. Ukraine right now with the war going on, look at everybody over there trying to provide medical care to people who desperately need it. So Western medicine in itself has a lot of good things to offer. It just needs a bigger way of thinking about the world. We need to know more about nutrition and about stress and about sleep and about other ways of getting to the root cause of what's driving illness, which has a lot to do with behavior and lifestyle. And those are tough things to tackle. When's the last time you tried to make a big behavioral change for yourself? It's hard. And,
Right.
and when I see a woman who comes in and she says, "I know, doc, I know, my blood sugar's high, I've gained 6 pounds." It's like, I know." And I'm like, "Well, tell me. Tell me what you're thinking." She goes, "Well, I know. It's like I'm gaining weight. I know I've got diabetes. I know I'm not really taking care of myself. I know I got it." And I just sit there and don't say anything. And then she said, name's Jane. She said, I'm just under so much stress right now." I said, "Well, tell me about that." So she started to share her story, and we're in a small town, so I knew part of the story. And then after about 5 minutes, which actually is a long time if you don't interrupt somebody, 5 minutes is a long time to share. And then I just said, "I'm so in awe of you. I'm so in awe of you, Jane." And she looked at me and she said, "What?" And I said, you got a lot going on and you get up and bring it every day, taking care of your grandkids, cleaning houses, being a single grandmother. I mean, it's like you just bring it every day. It's okay that you've gained a little weight. It's okay that your sugars are a little off. Let's step back and think about, like, what do you need right now? What would be most helpful for you, right? That was an 18-minute visit from start to finish. So this is what I'm saying. It can be done,
Yeah.
but in part, it's about, how do I come alongside you? How do I come alongside you to get what's going on instead of punishing people because they gained weight and their blood sugar's not right? It's like, why should she
Right.
feel like she's got to defend herself to me about that? It's like, it's her life, not mine. It's her blood sugar, not mine. I'm just there to partner with her.
Yeah.
I'm just there to partner. What do you need from me today?
It's such a great way of looking at. I mean, I think even in the health and the not just the Western world, I think in the health and wellness world, there's a lot of patient blaming or their own symptoms in a way.
Yeah.
You're told that if you don't, you know, live up to this incredibly strict diet, which is, in every way strict from, accessing it, paying for it, preparing it, that you're somehow the cause of why you're not doing better or why you got the illness. And I really fight that because I don't believe in that. And I think it goes along with how do you partner with your patient to meet them where their lives are at. But a lot of the messaging is always, it's your fault if you're not feeling better.
Yeah.
Your fault you got it. And your fault for not managing it and tackling it and getting better on it. So it's just a lot of, I think, so that I hear guilt in Jane. I feel guilt and almost self-blame, but, the idea is that it's you can't start to move and motivate unless you yourself get a break, and you just gave her that break. So, yeah, you can accomplish more in 18 minutes than just writing a prescription for medication, that is for sure.
Yeah. And I love that you raise some of the issues, because if we're going to have a conversation about conventional medicine, which overprescribes way too many drugs, medicalizes way too many things. When you have a 15-year-old who goes in to see the psychiatrist in Santa Fe, comes back to my practice, is now on Seroquel. I mean, and it's like, I call and it's like, well, I think she has bipolar spectrum disorder. And I'm like, oh my gosh. And I'm feeling like I am so out of touch. Like I didn't even know there was a bipolar spectrum disorder. I thought, and
There's
then,
a thing
and
like that?
uh-huh. Well, what's the issue? Well, she's 15 years old and she's been sleeping with a couple boys, and it's a very Catholic town, and and her mom's very upset. And so now she's on a really powerful medication that I wasn't sure, especially since she did not meet the diagnostic criteria for bipolar. We've now made a
Mm,
spectrum. The thing that people don't
mm,
often get is that medications tend to work really, really well for a small group of people. It's like they do. They work really, really good for a small group of people. But what happens is we begin to expand the pool of people that we prescribe to where actually the risks begin to outweigh the benefits. And that's not something we talk about. So in conventional medicine, I definitely, I feel like we overprescribe. I feel like we medicate even every human behavior and human feeling we medicate. Um, And
Right.
you said something about the health and wellness community, which I would also say I have issues with. We're just going to test you and test you and test you and find every little thing ever that could ever be.
Yeah.
And then I'm going to give you I'm going to give you $500 worth of supplements after $1,000 worth of tests that you had to pay for. Um, those kinds of things also are just another way you have to be careful. I'm not saying that at times that's not appropriate.
Right.
That's not what I'm saying. What I'm saying though is
Right.
we run the same risk of being reductionist to the point of every single feeling that we have can be alleviated. And I actually don't think that's true. And I don't think it's good. I think part of the human experience is living a full life, which means pain and joy and hurt and sorrow and great love and enjoyment and everything in between, right? So if somebody said, you know, so 7 years after my cancer diagnosis, I've made it past the 5 years. And they said, "Well, you come back once a year, so we'll do a scan." And Jim's like, "Oh, that's great." And I said, "I'm not doing any more scans. I'm done." And that made my husband very nervous because he's like, "We should catch it early." I'm like, "I'm fine." In 2020, my daughter Kiara was hospitalized 3 times in acute respiratory failure from COVID. She was satting. Even with 2 liters of oxygen, we could barely get her oxygen, her O2 levels over 80%. You know, she needed 4 liters of oxygen to even get up to like 90%.
Wow.
At that same time, we were caring for my parents, and I got them into hospice to try to give them more support. They were old. My mother had dementia. My father had very advanced cancer. And we became their primary care provider. Hospice couldn't come to the home. They would just leave things outside. My father died April 15th. We were there. My husband and I were there taking care of him. Then we had my mother with dementia. There was no putting her any place. There was no assisted living, and everything was closed in 2020. And so we had to care for her. My son came home to help. She died died June 23rd. And this whole time, from Mother's Day until July 11th, my brother, we got into the hospital with very advanced cancer, and we were trying to care for him, but they wouldn't let anybody in. So every morning I'm FaceTiming him. It was one of our fellows at Mayo that was helping to take care of him. And he died July 11th. And, you know, and I was sitting there sort of feeling the impact of losing everybody that I had from my birth, you know, all the people that I grew up with and my parents and my brother. And I thought, oh, so this is why I didn't go. Oh, so you were the only one that really, this fell to you. This was your job. So you're still here. Then my husband says, "Please don't say that." I said, "Well, I think it is." And he goes, "I know, honey, but then I'm afraid you're going to think that. And then because they're all gone, you're gonna die." I'm like, "Oh, honey." "Oh, honey, I'm gonna die whenever it's time for me to go, and nothing will keep me here, and nothing will make me go a day sooner." Um, these are the things about medicine, about life, about the human experience, is that these things happen to us, and part of the reason, part of our whole karma for being here is just to try to make sense of it in whatever way we can and to dance
Mhm.
with it. You know, there's this interesting movie, I don't know if you ever saw it. It's called Phenomenon with John Travolta. It's kind of an interesting movie.
Yeah.
I love this
Buy
movie.
my chairs. I always say to my husband,
Yeah.
as I said to my husband, buy my chairs. Don't worry about what you're buying, but know that it fills my heart. If you know what I'm talking about.
So
Yeah.
there's this part in this movie where this stupid rabbit keeps eating everything in his garden. He keeps eating everything in his garden. And he's like, I'm burying the fence down, 3 feet underneath the soil. I'm making the bigger gate. I'm going to do everything to keep that rabbit from getting in there. And one night, like nothing works. So one night he's like, okay, I'm going to do this differently. So he goes and sits out on the porch, and he's like got the gate open, and he's sitting there, and he's like, I'm going to wait, and I'm going to catch that rabbit as he's trying to go in. Right. And he waits on that porch and waits on the porch. And then he sees the rabbit run out of the garden. And he realized that he'd been spending all this time trying to keep the rabbit out when everything he had done
Right.
was keep the rabbit in. I remember that
Right.
story a lot because I've often thought about what do we do as human beings? What fences do we build to put all of this up around us, to put it all around us? And what is that like, what are we keeping in that we don't ever let out? What are we doing? What kind of fortress are we
Mhm.
building? And I think that I think that, this is the part that in medicine, whether you're integrative or alternative or conventional or any of the above, that the moment you stop honoring mystery, the moment you stop honoring just the mystery that is life, um, part of the magic dies. Part of the magic dies. And and for me, this is what this journey is about. And so it's like, okay, I'm gonna give you Lexapro, or I'm gonna give you St. John's wort. But the bigger question is, what's happening and why are you feeling the way you are? And where does that come from? And maybe I'll give you the medicine or the herb to help you not fall into the abyss, but I can't just give you a medicine or an herb and think this is suddenly going to be all better because we've tweaked your biochemicals. It's going to be like, what do we have to get into the belly of? Right? What's in there? What's in there? So that's where I think sometimes we miss the opportunity, whether we're
Yeah.
dispensing herbs or vitamins or dispensing medication, is that we don't sit back. We don't just sit back
Right.
and listen and try to go a little deeper.